Your children will have a lot of bests in their life.
You gotta love a children's health insurance commercial. They care. They really care.
If your kids qualify for CHIP or Children's Medicaid, they qualify for Texas Children's Health Plan. It's the best decision a family can make.
Bet you'll never see mental health therapist Rob Ortega in one of their commercials. You think these kids get cheated?
Yes, of course. They're not getting the help that they need.
Wonder if Texas Children's Health Plan knows what teachers and principals are telling Martha Lopez.
There are a lot of students, particularly in HISD, that have Texas children, and they're not receiving the services that they need.
And we all know what can happen when a student with mental health problems doesn't get the help they need. They can become a danger, and not just to themselves.
I didn't know what to think. I shouldn't be going through this at my school.
No student should be afraid to go to school. Texas must act now to make our schools safer.
TCHP gets $980 million a year, nearly $1 billion from taxpayers, to provide health care to needy kids, including mental health services. 385,000 kids just here in Harris County. But TCHP told both Martha Lopez and Rob Ortega they didn't need any more mental health providers in their insurance network because they already had plenty. You think that's bull?
I believe that's bull. It's about the money. I mean, what other excuse do they have?
Good question. When we first called TCHP to talk about the controversial subject of mental health for school children who need it, they sicked the big bad lawyers on us. What happened to all that caring stuff? The folks at TCHP later cried foul over this Dolcefino Consulting investigative video that aired in December. We called it Blowing the Whistle to Protect Houston Kids. And with a title like that, I was clearly up to no good.
If you really want to know the truth, it's a scam.
Troy Marsaw of On-Site Counseling Service has become TCHP's public enemy number one.
The bottom line is that the health plan is profitable from not allowing these kids to be seen.
But he's clearly not the first person who's ever suspected an insurance company was being greedy. He's repeatedly filed formal complaints with the state of Texas. This investigation proved TCHP should have paid for dozens of kids they refused to pay for. Quoting, 62 of these were in TCHP prior to the contract termination for on-site counseling. HHSC was able to verify that services were received prior to the contract termination. Since 2015, TCHP has been fined $1.9 million for either not paying claims or for not having a provider to provide the service. And you think it's because, simply put, they don't want to spend the money for mental health for children?
That's my opinion.
Because it makes it very difficult from a legal strategy for us to respond, for us to defend, for us to protect TCHP, because he continues to make these little wins along the way.
But it's this secretly recorded audio tape that has the high-priced TCHP lawyers all in a flutter. It may be evidence of retaliation against those folks who are sounding the alarm.
Now, currently as we stand, is they're an out-of-network provider. So in my mind, they're automatically, it's null and void.
Just days after our broadcast of this revealing audio, TCHP went to court to get a restraining order against Troy Marsaw. Quoting, cease, desist, and refrain from publishing and or disclosing any recording or materials pertaining to TCHP's meetings and communications that may contain internal discussions among TCHP personnel and its attorneys. In other words, you don't have a right to know if an insurance company getting your tax money is playing games. Late in January, we got our second threatening letter from Carlos Rayner, a partner with the high-priced law firm of Norton, Rose, Fulbright. Quoting, "We again request here your return of the audio recording. We further request you remove the video from the internet." If TCHP's big high-priced lawyers didn't like that first piece of audio tape we played in December, well, I've got a hunch they're gonna like part 2 even less. But you know what? I don't like bullies. This is about the kids and about your money. You rarely get to hear insurance company folks behind the scenes joking about how they deny coverage, especially when a mental health counselor has just asked to see a kid in trouble just to try and diagnose what's wrong.
They are getting smarter, right? Because we were previously denying therapy because you have no diagnosis. So now they're asking for this.
Right, I would challenge the smartness, but because
Hey, anyone got a copy of my license? Look, I'm no medical professional, but let me ask you this question. If you're a mental health professional, how do you diagnose a child who may need help if you don't actually ever get to see the child? Or maybe that's the point. Here's a call between on-site counseling and Dr. Scott Gordon from Preston Associates, a Wisconsin company TCHP uses to review claims after they have been initially denied.
Have you ever seen?
No, why? This is a peer-to-peer. I wouldn't have seen.
Okay, so then if we've never seen either, and so okay, so we're doing a peer-to-peer on someone we've never seen. So how do we start?
Good question. I don't know.
And I think that TCHP, Texas Children, is willing to roll the dice for profit.
I do believe somebody needs to take a closer look at what TCHP is doing.
Texas Children's Health Plan. It's the best decision a family can make.